When it comes to your pearly whites, sometimes a root canal is necessary when your teeth are badly decayed or infected. And while the procedure may sound scary, it can essentially save your teeth. Joining us live to discuss is Dr. Natasha M. Flake, president of the American Association of Endodontists. Thank you so much for joining us. Good morning.
Thank you, and good morning. Thanks for having me.
Can we just start off with the difference between an endodontist and a general dentist, just to clarify?
Sure. An endodontist is a dentist. We've all graduated from dental school, but we've had 2 to 3 years of additional training after dental school. And an endodontist is a highly skilled specialist at diagnosing and treating tooth pain, at performing root canal treatments, and in helping our patients to save their natural teeth.
Okay, and root canals, I mean, people talk about them, they're not fun, not the favorite thing to do at the dentist, but what are some of the biggest myths around root canals?
Yeah, probably the biggest myth about root canals is that they are painful. And we think that this myth exists because our patients associate the root canal treatment itself with the pain that they had leading up to the root canal. The root canal is designed to help alleviate pain and to prevent infection. And modern root canal therapy using modern techniques, modern anesthetics, really is virtually pain-free. It really is no different than going and seeing your dentist to have a cavity filled.
Okay, that's good to hear. And why should root canals be considered first over tooth extraction? Because those both don't sound good to many people, right?
Right. So root canals are designed to save your natural tooth, and our teeth are so important for us. They are important for our nutrition. They allow us to bite and chew and eat. They're important for speech. They help us to form our words. And root canals are also important for cosmetic reasons. Our teeth are important for cosmetic reasons, part of our smile. Smile is often the first thing that someone notices about us. So root canal treatment allows us to help to save our natural teeth because nothing really looks or feels or functions like a natural tooth does.
Okay. And, I guess let's talk about the signs for what to expect or what, if you start to experience pain or whatnot. And then what do you mean by pain? Like what kind of pain would it be in that discomfort in your mouth?
Yeah, that's a really important question. So the pain can take different forms. So oftentimes it's pain to biting or chewing. So you're chewing on your food and it's really uncomfortable. It also can be pain to hot or cold. So temperature sensitivity is a very common sign that a root canal is needed. Other ways that it could present would be with swelling or sometimes a bump on your gums and maybe some drainage that might be coming from your gums. And then another time when you would want to seek care from an endodontist is if you've had dental trauma or think that you have cracked a tooth.
Okay. And then lastly here, where can we go to learn more on this and maybe some tips to prevent having to get a root canal?
So to learn more about tooth pain, about root canal treatment, and about endodontists, you can go to AAE.org, and that's the American Association of Endodontists website. It has a lot of great patient information. And to find an endodontist in your area to help you to alleviate tooth pain or take care of a tooth that needs a root canal, you can go to findmyendodontist.com.
Okay. And am I good flossing? Will that help me prevent it?
That is the first step. Home care and prevention is really the first step to helping to keep your teeth, brushing and flossing at home, seeing your dentist regularly for preventive exams and taking care of problems early. But if you do have a problem or you do have tooth pain, then you can seek care from an endodontist who can help to alleviate the tooth pain and save your tooth.
Awesome. I love it. Thank you so much for joining us, Dr. Natasha Flake, and I'll be flossing a little bit more from now on.
That's great. Thank you so much for having me this morning.